Hello guys, welcome to my presentation. Myself Ajinsha. Today in this presentation we can see some of the common clinical conditions in hip biomechanics. First, we can see what is slip capital femoral epiphysis. Definition: it is a most common adolescent hip disorder occurring when the femoral head displaces posteriorly on the femoral neck at the level of growth plate. In this picture, we can see the femoral head displaces posteriorly on the femoral neck at the level of growth plate. Causes: the main cause is causa vera and a high body mass index. Incidence: teens and preteens, that is adolescent, and it occurs more in adolescent boys. Clinical features: hip pain, medial thigh pain, knee pain, acute onset of limping, decreased range of motion. Etiology: it is due to increased force applied across epiphysis, and the obesity is one of the most significant risk factor. Diagnosis: we can diagnose through X-ray. In X-ray, head displaces posteriorly and inferiorly. Now we can see the next condition, that is acetabular dysplasia. Definition: it is a disorder that occurs when the acetabulum is shallow and doesn't provide sufficient coverage of the femoral head, causing instability of the hip joint. In this picture, we can see acetabulum is shallow so that the thigh bone is dislocated from the acetabulum of hip bone. Now we can see the incidence and complications. Incidence: developmental disorder of hip, family history of hip osteoarthritis, hip conditions like infection, trauma, etc. Residual acetabular dysplasia. Complications: articular cartilage damage, labral tear, and hip arthritis. Clinical features: anterior hip or growing pain, worsen in hip activities, and a high hip flexion. Diagnosis: we can diagnose the acetabular dysplasia through X-ray, MRI by checking range of motion, muscle weakness, and abnormal gait. Treatment: the common treatment given to acetabular dysplasia is periacetabular osteostomy. Next condition is acetabular protrusio. Definition: it is also known as acetabular protrusion. It is an intrapelvic displacement of the acetabulum and femoral head so that the femoral head projects medial to the ischial line. In this X-ray, we can see that the femoral head projects medial to the ischial line. Next condition is causa profunda. It refers to a deep acetabular socket. On pelvis X-rays, it is seen that the acetabular fossa is being medial to the ilioischial line. To be noted that in the condition acetabular protrusio, where the femoral head is seen additionally medial to the ilioischial line. This causa profunda is more common in females. In this X-ray, we can see that the acetabular fossa is medial to the ilioischial line. Normally, the acetabulum is anteriorly oriented 20 degree anteverted and inferiorly oriented 50 degree. Any change in this decrease leads to abnormal. Here, there are two abnormalities seen in acetabular positioning. First, anteversion. Here the acetabulum is positioned anteriorly, normal in the transverse plane. The degree of anteversion is greater than 20 degree, so that it can lead to decreased stability. Retroversion. Here the acetabulum is positioned posteriorly in the transverse plane, so that it leads to over coverage and hence impingement can occur. In this picture, we can see the difference between normal femoral neck anteversion, increased femoral neck anteversion, and femoral neck retroversion. Thank you all for listening to my presentation.